Begin your physical exam by carefully exposing your patient. You should never perform your examination over the patient's clothing. While your patient is still calm, this is the best time to listen to heart, lung, and bowel sounds. Take your time and see if you can hear a murmur. Next, we'll go straight into our respiratory assessment. When performing your respiratory assessment, assess for nasal flaring, grunting, and cyanosis. Retractions can be present in the suprasternal, intercostal, or even subcostal areas. Also watch and see if your patient is belly breathing, which is a sign of distress. When listening to lung sounds, it is important to compare the lung fields both top to bottom and left to right. It is also important to auscultate the posterior lung fields. Now that you've listened to the heart and lungs, you can now listen for bowel sounds. Since you are already in this area, you can gently palpate the abdomen now. Now we will proceed with a head-to-toe approach. In infants less than 14 months old, make sure to palpate their fontanelles. The anterior fontanelle and posterior fontanelle are located on the top of the head. They should feel soft and flat. Also observe the head shape, checking for abnormalities like plagiocephaly. Next, proceed with your assessment, checking pulses, cap refill, sensation, muscle tone, and skin. For infants, assess the brachial pulses on the upper extremities. Next, repeat the process with the lower extremities. Keep in mind, you are assessing multiple systems simultaneously. This is a good time to practice your posterior tibial and dorsalis pedis pulses. Next, we will move on to the GU assessment. Assess the diaper area for rashes, skin breakdown, or any other abnormalities. Also assess the external genitalia. Ask permission when caring for older children. Always assess the posterior surface of the patient. Make sure to save any intrusive or scary procedures to the end. Congratulations, you have completed your first assessment. Make sure you put those side rails up